Thank you, dear friends, for your kind attention and for following us closely. You are following our ear surgeries, jaw surgeries, and all our other aesthetic surgeries. Thank you very much. Thank you for showing us your interest. You always reach out to us. I would like to provide you with small bits of information about ear care. You are aware that every physician uses their own unique techniques in ear surgery. I have been using my own developed anchor technique for surgeries for a long time now. I am grateful that this technique has a high success rate and a low rate of needing revision surgeries. Therefore, the technique we apply is indeed well liked and receives attention. In our method, we start by making the ear adjustments a bit closer than normal during surgery, as each ear has its own elasticity. You may have heard of the concept known as cartilage memory. If you haven't, let me explain it to you. Cartilage memory refers to the fact that we shape the ear by manipulating the cartilage during the process. Cartilage memory is when the cartilage tries to go back to its original state. And here, a struggle essentially begins. Our application is in a battle while the cartilage tries to return to its former state. We win this battle 98% of the time. This indicates that the cartilage cannot return to its previous state. Only 2% of the time does it succeed. Then we say to the patient that there is a 2% chance of this happening. We must perform a revision surgery. The way to win this battle, dear friends, is during the surgery. We pull the cartilage back 2 to 3 units more than necessary, actually, because in this fight, some stretching will definitely occur. When it stretches and reaches its final state, we aim to achieve the result we truly desire. Essentially, we are tricking the cartilage a bit. That's why, please don't be alarmed by the images we share or the immediate post-operative images from our surgeries, which are very close-up views. Don't let the unappealing image frighten you. We do this knowingly as we are aware it will stretch. We tell our patients this. Our patients do not fear during this process because they are aware of this reality. They do not panic. And we manage the process in a healthy way. And we are grateful for the beautiful result we achieved in the end, as we always hear words full of praise. So, at the beginning, it may seem too close to you, but don't let that bother you. We are doing this intentionally. Occasionally, I come across comments from individuals undergoing ear surgery for the first time, saying to me, "Who has done thousands of these surgeries, that I performed it very closely, dear teacher. It didn't happen." Honestly, we laugh at you more than you laugh at us. But still, in such comments, let me say that not knowing a bit reduces your excuse for the fault. We always try to explain and inform like this. At first, the ear will be closer than necessary. It will slowly open and expand. After the second week, it starts to look good to you. Let's open it, Ilkay. In 2 to 3 months, it will fully settle and achieve its final form then. Like I mentioned, we win this struggle 98% of the time.
Did we explain it well, external voice? You explained it beautifully, teacher. I will now place a sample video on your right side during the editing. Our patients will watch while you explain. I will present the transformation of one of our patients from 5 years ago. It is a remarkable change.
Yes, occasionally people ask about that. I see you always show the results after surgery. What happens after 1 year? Actually, whether it's 1 year, 5 years, or 10 years later, the ear we create stays beautiful. You will use this result for life. Ultimately, we are not performing a temporary procedure. The ear is your ear. The surgery is your surgery. We achieve a result, and you will utilize that outcome for the rest of your life. Sometimes, 5 years later, they say they want to see the long-term picture, doctor. However, when they see the long-term picture, they ask why they came after 5 years. It's akin to searching for a calf under an ox. They come to visit, and I monitor my patients for a year. After the first year, I say, please come to visit your brother Ali once a year. We conclude the medical treatment at the end of the first year. 5 years later, they either come for a visit or bring another friend. They come to enjoy our tea or coffee. Then we promptly ask for a photo for you so you can see it from our patients. However, you will be able to use the results of this surgery for life. And let's say there was a problem. Ultimately, we are certainly not gods, nor are we any physician. We are as talented as Allah, and there is no infinite limit to what we can do in case you encounter a problem or face difficulties. If we are still here and not retired, let's address your concerns together. We won't tell you to leave us. No need to be concerned about our patients, spouses, or friends in that aspect. Is there another question from the outside?
Did Dr. Ali's explanations make sense to you? Yes, they did. There are no lingering doubts in your mind anymore, right?
Exactly. It's either clear now or it's at the back. What effect do their stories have on the square? Yes, sir. It goes right to the brain, right?
What you say goes straight to the brain.